I think there's a lot of value in trying to harmonize your life more than balance. I think balancing is very, very hard. What I mean by that is like balance means I'm going to try to give like equal weight to different things, equal time. But harmonizing is like, maybe I'm going to include my kids in my fitness. My kids are catching the value of fitness because they're seeing me do it at home. And maybe they're playing and maybe it's distracting. And dude, the amount of times I've had to listen to the Frozen soundtrack in my garage gym, like, it's not ideal, for a big squat day, you know what I mean? But they're also seeing it. They're seeing mom and dad, prioritize their fitness. So that's what I mean by harmonizing. It's like maybe we can kind of bring it all together.
All right, everybody, welcome to Stronger Weekly, brought to you by Purist Nutrition. I'm your host, Jesse Karajat. Thank you so much for being here. Got an awesome episode lined up for you today about chiropractic medicine. I've noticed, and maybe you've noticed it as well, there's a new frontier in the world of chiropractic medicine. Even in just the people around me, let alone online. I have really, really good friends who have relied on the care of a chiropractor to help their kids with conditions that I didn't even know a chiropractor could help with. And then there's other areas, there's prenatal, there's sports. So I'm just feeling as though chiropractors are doing a lot of awesome work out there, and not everybody fully understands like what they're doing and what they can help with. So I have a great guest that's going to come on the show. His name is Dr. Dan Wallis. He is local to me. He's a Northern Colorado chiropractor. He's the founder and owner of Elevate Chiropractic out of Fort Collins, Colorado. Not only do they do general chiropractic care, they also have specializations in pediatric, prenatal, sports. They're doing lots of stuff. And one of the things, one of the reasons I'm most excited to talk to Dr. Wallis is because based on what I know about him, with his online presence, but also mutual friends, is that he's a man of faith. He is committed to being an amazing father and husband. He loves fitness. He does Brazilian Jiu-Jitsu, which is something that I've done as well. So him and I will probably connect on a deep level as well. But we'll also make sure to go through all things chiropractic medicine and touch on all these specializations that they're doing. And I hope you learn from it. And then maybe you'll get some help and get some treatment from a chiropractor in the future. We've also got some health and fitness headlines we're going to cover, as we always do, before we go into the deep dive. Look, if you don't want the news, you can just skip forward to when Dr. Wallis joins. But more news on Ozempic. We got some good stuff around how important it is for toddlers to have really good nutrition when they're young, stuff around ADHD, measles, and other stuff. So some great news headlines coming up. So let's jump into the health and fitness headlines of the week, and then Dr. Wallis is waiting for you on the other side. Let's do it. All right, first up, could weight loss drugs also treat addiction? A new study says that might be possible. So published this week in the BMJ, researchers analyzed over 600,000 VA patients with diabetes over the course of 3 years. Those on GLP-1 drugs like Ozempic and Mounjaro had significantly lower rates of developing addiction. How much lower, you might ask? 25% lower for opioids, 20% lower for cocaine and nicotine, and 18% lower for alcohol. For patients who already had a substance use disorder and essentially went on these drugs, the results were striking: a 39% drop in overdoses and 50% reduction in drug-related deaths. And again, folks, this is not a small sample size. This is 600,000 VA adults. So lead author Dr. Zayed Al-Ali put it this way, quote, "We're talking about a diabetes and obesity drug, not an addiction drug. What's surprising is the breadth and consistency of effect across all these different substances." So clinical trials are now underway. This will not replace addiction treatment, but it could become part of it in the future. Next up, your toddler's diet may be shaping their behavior, and what your preschooler eats may affect how they act years later. So a new study in JAMA Network Open tracked over 2,000 Canadian children from age 3 to 5. The finding: kids who ate more ultra-processed foods, we talk about a lot on this show, they're called UPFs, such as packaged snacks, sugary drinks, ready-to-eat meals, showed higher rates of anxiety, aggression, and hyperactivity by kindergartner. And those are not traits that you want to see in kindergartners. Every 10% increase in calories from UPFs was linked to measurably worse behavioral outcomes. Sugar-sweetened beverages showed the strongest Association. Here's the context. In Canada, nearly half of preschoolers' calories now come from ultra-processed foods. In the US, it's closer to 2/3, so even worse. So the good news, when researchers modeled replacing processed foods with whole foods, behavioral scores improved, which means that these effects can be reversed. Last week, I covered a similar story that it really matters what kids eat when they're younger. However, if you get ahead of it, you make changes, you eat healthier, you could reverse those negative outcomes. So feed your kids healthy, folks. Next up, if two kids with ADHD can seem completely different, they might actually be. So a new brain imaging study published in General Psychiatry used machine learning to analyze MRI scans from children with ADHD and found two distinct subtypes based on brain structure. In other words, there's different types of ADHD. We kind of use it as a blanket catch-all diagnosis. But here's more. The first subtype showed changes mainly in attention networks, the frontal cortex, and cerebellum. The second showed widespread reductions across the entire brain, including regions tied to emotional regulation and memory. This may explain why some kids respond to attention-focused therapy, while others need medication or combined approaches to get well. So the takeaway, ADHD may not be one disorder after all. It may be several, and personalized treatment could be the future for treating ADHD. Next up, measles. I keep seeing it in the news. I haven't covered it. So here's an update. In South Carolina, specifically, measles outbreak is now the largest in the U.S. since measles was declared eliminated in trivia. When was it eliminated? The year 2000. So this week, the state reported 990 confirmed cases, nearly all centered in Spartanburg County. The CDC is now deploying disease detectives to help contain the spread 5 months after the outbreak began. So of the cases, 86% are in children 19 and under, and 94% were unvaccinated or have unknown vaccine status. In other words, a bulk of these 990 cases are in minors, and 94% of that bulk were unvaccinated. So connect the dots, folks. There is some positive news. Vaccinations in Spartanburg County surged 162% in February 2026 compared to last year. So folks are getting the memo. State health officials say the pace of new infections appears to be slowing. Thank God. The U.S. may lose its measles elimination status later this year. The Pan American Health Organization will decide that in November. And your last health and fitness headline, more of a story, and it's about the world of addiction, alcohol use disorder specifically. So for years, Alcoholics Anonymous has emphasized a, quote, higher power. 90 years, if you might ask for how long. Now Harvard, yes, that Harvard says there's real science behind the impact that belief in a higher power can have for those suffering with addiction. So a major meta-analysis published in JAMA Psychiatry reviewed 55 studies tracking over 500,000 people. It's a lot of people. And here's the findings. Spiritual practices such as prayer, meditation, attending religious services were all associated with a 13% reduced risk of hazardous drug and alcohol use. So for people who attend services at least once per week, that reduction jumped to 18%. So that's from 13%, generally believing in a higher power, 18% if you are regularly attending some type of religious service. And the effect was consistent across all the things that hurt us: alcohol, tobacco, marijuana, and illicit drugs. So the researchers note this isn't about any specific religion. It's about connection to other people, purpose and meaning in life, and having community. That's what it's about. So nearly 49 million Americans currently have a substance use disorder, and only about a quarter actually get treatment out there. And faith might be one such tool. If you are one of these 49 million Americans, you happen to be listening right now, and I'm blessed for the opportunity to speak to you. You're not alone. Get help. There's stuff out there for you, and we're here for you. And that's it for this week's health and fitness headlines. Just a quick word from our sponsor, and then Dr. Dan Wallis joins us on the other side. We'll see you over there. Real quick, I want to talk about something I'm genuinely fired up about. Look, I train consistently, even when I'm tired and running on 5 hours of sleep and maybe even on fumes. Training is a non-negotiable. It's how I stay sharp, stay consistent, stay sane, and frankly, how I get through my day. And here's something I'm not proud of. For years, when it comes to pre-workout supplements, I just grab whatever is on sale, whatever is cheap and convenient. And I know that I was putting crap in my body that I will come to regret, which is why I am so stoked that my partner, Purist Nutrition, has launched their own pre-workout supplement. It's been what I've been waiting for. Clean energy, real focus, natural ingredients, endurance without the crash, no artificial dyes, no sucralose, no hormone disrupting junk, just what I actually need to train hard and recover clean. This is the pre-workout I wish I knew about 10 years ago, and I'm so glad that I now have it. It is amazing. So go to puristnutrition.com. That's puristnutrition.com, and you can find your Purist Nutrition pre-workout supplement. One more time, puristnutrition.com, and get your Purist pre-workout supplement for yourself. All right, everyone, Dr. Wallis is here. Should I call you Dr. Wallis or Dan?
You can just call me Dan. That's great,
Dan?
Man. Yeah, perfect.
No can do. Respect where respect is due. Dr. Wallis is here. Thanks for coming on the show. How are you, Ben?
Man, Jesse, I'm honored to be here, man. Thank you for the opportunity. I'm doing great, and I'm grateful for a chance to be here and chat with you, brother.
Well, thank you for saying yes. I asked you to come on, so I'm very grateful that you're here. We got a lot to unpack. I just made an attempt offline at understanding your credentials. And I just told you that I don't normally do this, but because it's chiropractic medicine, I really want people to understand what you do. I am going to ask you if you could just kind of go through your credentials, your training, and all that stuff, because that'll lay the foundation for the practical stuff later. Is that all right?
Well, I think my most important credentials are, follower of Jesus, husband, father. Right. So I don't know if there's an acronym for those that we can alphabet soup. Yeah. DAD, HUBS, hubs. You know what I mean? Hubby. I don't know. No, I'm a doctor of chiropractic. So that's a DC. That's the main gig there.
And what drew you to chiropractic medicine in the first place?
I mean, I grew up with chiropractic. My dad was actually a chiropractor, and believe it or not, that's probably not the reason that I chose to be a chiropractor. It's probably a podcast for another time. He didn't talk about it much as like a passion project. It was kind of just something that we did. So I was used to it for sure. But when I went to college, I initially started in business, but then I transitioned into more of like a pre-med. It was called an integrative physiology track. And I thought I'd do something probably in sports medicine, right? I was going to do ortho or, something in sports. I always grew up in sports, so I wanted to do that route. But then as I got more into it and a little bit further along, I've always been more naturally minded when it came to health, probably because of my upbringing, right? Like I wasn't a huge fan of drugs and surgery. And so starting to get into even doing some shadowing of doctors and seeing like, man, a lot of what they do is kind of A plus B equals this medication. At the time, I was a personal trainer. So I was helping people with their health and their fitness naturally. And I started sending a bunch of my clients to actually a local chiropractor, and they just skyrocketed, dude, through their plateaus and to their goals. And I was like, man, there's something to this. Long story short, I had a mentor in Pennsylvania who's still somebody very close to my life and man I respect very much. He started explaining to me more of the nervous system side of chiropractic. And I was like, that's cool. That's not just popping your back. You kind of pop your back. I'd go get adjusted and kind of think it felt fine, but I'd never understood the neurological side of that. And once that door opened, man, I was like, that's different. That's very, very cool. It's a great way to empower people and, and to make an impact. And so that's what got me into it.
So were you an athlete in high school? And like, how did you wind up getting into personal training and fitness in general?
Yeah, it's a good question. It depends on who you ask. I think my buddies would say I was not an athlete in high school. I'm just joking. Played JV football through my junior year of high school. Anyway, but yes, I played football and lacrosse in high school and kind of always stayed involved in athletics. And so the weight room was a place that I really have always enjoyed since high school. And so personal training was. And at CU, actually, I started playing club lacrosse there. And then I actually ran Ralphie. So I went to the University of Colorado, ran the Buffalo. And so that kind of kept me in athletic mindset and, jumped into personal training just to make some money on the side in college.
That's cool. And it's cool that you had clients, it sounds like, that were getting the benefits of personal training and also chiropractic care. And you saw that the chiropractic care was translating over to benefits in like sports and fitness. Yeah.
Big time. Big time. I would send as many of them as would go to this local guy in Boulder, and they would just crush their goals faster. And I was like, there's something else there for sure.
That's cool. And we're going to get into, I think one of the three topics that I really want to unpack with you is this kind of sports chiropractic field. But before we do, just one more question because of the way that you introduce yourself about your faith. You have, it's Kingdom Dad, right?
Yeah.
Kingdom something. Talk a little bit about that if you could.
Man, that honestly is just going to be, something that I'm going to keep an open hand on and see what God wants to do with it. That's more just something that's on my heart now. It's not something that's really into fruition at the moment. But if I boxed it up, I'm really passionate about young men pursuing Jesus and a great wife and having a bunch of kids, and that being like a crux of their pursuit versus status, wealth, sex. I mean, whatever it is, like, I think the world needs great men, and I think a great man leading a great home changes the world. I'm really passionate about that. And so I just think the importance of fathers and present fathers, and if men would, again, in that order, focus on their relationship with Jesus and focus on diving into their faith, pursue a great wife and be a great husband, selflessly loving, serving her, and be excited about, having kids and raising them well in a great home, that he's present, he's intentional. But I think the world changes. And right now we're getting on a monthly prayer call. Men from all over the country will jump onto Zoom Saturday mornings once a month, real simple, like open-handed, not a big thing. There's not like a funnel or drip where I'm just like, look, let's get together and pray. I think that's a great way to start, you know what I mean? And then we'll see what God wants to do with it from there.
I love it. I love it. Maybe it could be another podcast. I was going to ask you, normally when the Lord puts something on your heart, it's for a reason. And it's usually either what you've been through or how you might serve. And I was going to ask for the why underneath that, but maybe we can hold that for another one. If it's okay with you, let's get into some practical stuff here. And we're going to unpack these different, I'll call them like specialties, because I don't think it's my sense that most people don't fully understand the wide range of issues, conditions that like chiropractors can treat. And I can say that about myself. Quick context, we have some mutual friends, and we were over one of their houses, this couple, and they had just shared that they had brought their daughter to your practice for a condition or an issue that I didn't even know chiropractors could treat. And they had an amazing experience with you. And then that was the catalyst for me reaching out, because I also knew by reputation that you're a man of faith, and I love having men of faith on my show to talk. But when I was like, whoa, I didn't know that. I bet you there's so many other people who don't. And this happened to be a kiddo, so it was a pediatric patient. So if we could start with pediatric chiropractic, correct me at any point if I'm not using the right nomenclature here. But why don't you just unpack what that is, and like what are some of the common issues or symptoms or things that can be treated by a chiropractor if it's a pediatric patient, so a kiddo?
What you said in the beginning is something that as a profession, we've done a poor job of really educating what chiropractic is. I think starting especially in the 80s, when insurance came into play for chiropractic services, they said, hey, this is more about fixing pain. It's more about like some kind of a pain relief for back pain and neck pain. And sure, chiropractic is great for that. But I tell all of my patients, Jesse, I'm like, dude, using a chiropractor just for pain is like buying an iPhone for a calculator. Like, it's going to work, but dude, there's so much more that you can do with these things than just, it's like, sure, you're going to be happy with it, but my gosh, right? So the real crux of chiropractic is it's all about the nervous system. At the end of the day, the whole perspective is that chiropractor is what we do. And the principle of it is that your body is made well. It's designed to be well. This just kind of integrates my own faith into this, but God didn't make a mistake when he made your body. It's made well. It's designed to be well. And you have everything you need, the capacity to thrive in your health. And health starts with your nervous system, and your brain and your spinal cord control everything. So whether it's your immune system or your gut or your legs for running, like it all starts with your brain and your spinal cord. And kind of a cool sidebar, when a baby is forming in a mother's womb, like two cells come together, they start dividing. First thing that forms, guess what? Brain and spinal cord. Then all the organs and stuff come after that. It's pretty cool. So our whole perspective is not even that we treat a bunch of stuff, right? So In this particular context, this individual, that little girl, she had like some ear infections, and I've seen little kids with maybe they have digestive stuff or colicky babies, things like that. Are we treating these conditions, or are we removing interference so that their nervous system can optimize and the body can do what it's created to do? It's to adapt. That's the main word, is to adapt to stress. And so what we do more than anything, man, is help the body to adapt. So in the context of like an ear infection, for example, yes, we can do some adjustments in the upper cervical spine to help open up the eustachian tube, maybe help some draining. But when you optimize that nervous system, and now that kid is going from a chronic state of fight or flight, right? Their little body thinks it's running from a tiger chronically, which is actually suppressing their immune system. If you can get that back into some nice ease and balance, into rest, digest, and heal, fight or flight when necessary, all of a sudden, her body's the one healing itself. Does that make sense? It's not about me.
Yeah.
And so I love that perspective of like, man, we're just removing interference from the body doing what it's supposed to do without drugs and surgery. So rather than chiropractors treating a bunch of things, it's more about optimizing the nervous system so that the body can adapt and heal itself the way it's supposed to. Does that make sense?
You explained it in a way that makes sense. It gets complicated, and I'm thinking of a follow-up question, and it's too complicated for me to ask. But it sounds to me, and if I don't ask this right, hopefully you can fill in the gaps. But she had an ear infection, and the body is basically picking up on the fact that we have a problem here, and then it's going into hyperdrive. And what you're doing is you're coming in and you're calming the nervous system so that the immune system, the body, whatever, this is where I fall off a cliff with my intelligence, but it becomes more efficient so that I can heal faster. Am I close?
Totally. You absolutely nailed it. You nailed it,
Okay.
Dr. Jesse.
I feel good.
I'm going to start calling you Dr. Jesse. No, you nailed it. And yes, with an ear infection specifically, yes, there's mechanical sides to it too. The atlas being so close to the eustachian tubes and how kids and how the pediatric bodies are forming, stuff like that. There's definitely things there, but the root of it is with the nervous system. That's absolutely correct.
Wow. We have another, my wife and I have another couple that we're friends with that actually got care. It could have been you for all I know, honestly, Dan, but they had a baby that was colicky, coughing all the time. It was crying all the time, having a hard time sleeping. They actually brought the newborn to a chiropractor and had amazing results. Is that something that you're seeing more? People bring in babies as well?
Yeah, man. And a lot of it comes back to education, right? Because I think a lot of people, unfortunately, our fault, they assume a chiropractor is just a crazy twist and crack and pop of the neck or whatever it is. They've seen the YouTube videos, they've seen the whatever it is, and they just assume that's like, they're like, why would you do that to a baby? It's like, yeah, why would you do that to a baby? Because I wouldn't, right? So that's for sure not what it is. But yeah, man, I adjusted I have 3 daughters, and all of them got adjusted within an hour or two of birth. Why? Because birth, man, I mean, I'm sure you've seen it, right? Like it can be tough on mom, but man, the twisting and the pulling on the baby's head, we want to check that stuff right away and just make sure again that they're set up. So in the case of colic, same idea. It's oftentimes the baby is just chronically crying because of like digestive stuff or pain in the stomach and gas and all kinds of different stuff. They just can't, express that. And so you start to open things up, get that nervous system moving. A lot of times the nerves that go to the digestive tract, if they're not operating well, the stomach can't get into what it needs to do. So you start adjusting a little bit, again, optimizing their nervous system. We see babies blow out their diapers on the table all the time, or at least on the way home. I always tell moms, I'm like, look, he or she might blow out on the way home. It happens all the time. You know what I mean? And sure enough, I'll get a text. It's like, you were right. You know what I mean? Like, it was crazy. But again, it's not because we're wizards. It's because we're just allowing their body to do what it's supposed to do. Right. And that can be a game changer, man.
Yeah, it sounds like it. What are some other maybe common conditions that you treat with pediatric patients?
Yeah. Well, I think in kids, man, it can be sports, falls, accidents, stuff like that for sure. I've seen a lot of kids with, it's more about the immune system. It's more about school. Like they are missing so many days of school. They're chronically sick. Every time someone has a sniffle, they have it for several months. I remember early in practice, I had a little girl who missed over 100 days of school. I didn't even know there was 100 days of school, right? Like she missed like the majority of a school year the year before. And then the next year she missed like 2 or 3. Again, not because we're a wizard, but like her body was just functioning so much better. But I think a cool side of this too, Jesse, is like the neurological stuff that kids go through, whether it's like sensory or ADHD. or like the neuro side where it's like, these kids their nervous systems are in a chronic hyperdrive, chronic fight or flight. They're wound up, literally. They're wound up, right? And they're staying that way. And then you combine that, and we don't have to dive into this too much, but you combine that with medications for their gut health early on. They're taking some kind of some to get their stuff going. They're getting all kinds of vaccines, whatever, again, maybe taboo topic, but like there's a bombardment on the little body.
Maybe poor nutrition as well.
Totally, dude. And Miralax for their gut health that's not working. Whatever it is, you create almost a perfect storm, and that baby's nervous system is so wound up. And so then it's like you just start almost unwinding that system to let the baby heal. And so the ADHD, the sensory motor stuff, I've had severely autistic kids. Their parents love to bring them in because they get adjusted and it really calms them down. It's not like a cure for their autism, but man, dude, you have a kid that, we had one kid that his first words, he came to his mom with like, "I love you." Like, bro, it gives me chills, right? Again, it's just about relaxing that nervous system more than it is about treating something, but their body healing itself. Does that make sense?
Yeah, it makes complete sense. It's almost like you're restoring the environment to a healthy place so that it can heal, and then combined with other therapies and other treatments, they just have the best shot of getting well. Is that fair?
Exactly, man. Exactly. Again, I believe God didn't make a mistake when he made the body, and we have everything we need to thrive. So if we can, rather than putting a bunch of stuff from the outside in, if we can get the body healthy from the inside out, that's the perspective shift for health that makes a huge difference for so many families.
Love it. Well said. One more question on the pediatric front, and then we're going to transition to the prenatal side. Would you recommend that parents listening take a proactive and preventative approach, meaning like factoring a chiropractor into their, biannual or annual care plan, or coming more reactive to when a situation arises?
That's a good question. I look at it, it's always better to be proactive when it comes to health than it is to be reactive. Right? Same way you look at your teeth, right? I want to brush my teeth and take care of them before I've got a bunch of cavities, and stay proactive. And so the message and the truth around chiropractic, if it's like, okay, I want my spine aligned, we want it moving, we want the nervous system adapting to the physical, chemical, emotional stress of life, like period. If you're a human on this planet, you're succumb to those stressors. It's part of it. And so what we got to do a good job is educate parents on like, why would that be valuable to my family as a proactive benefit? Because yes, absolutely. I get adjusted regularly for myself. It's part of my weekly routine. I adjust my kids probably at least once or twice a month, for maintenance, and it's easy because they live with me, right? But it's a lifestyle thing. I want their little bodies free of nerve interference, free of nerve pressure, so they can optimize when the next ththing happens. I want them to be as healthy as we can. So yeah, it's definitely something to stay proactive with versus reactive.
It starts with education and awareness. Right. You keep do these podcast tours, and you'll get the word out there. People will start signing up. Yeah. How many kids do you have, by the way?
I've got 3 little girls, and praise God, 1 on the way. So,
ooh, let's go.
Yeah,
4.
Man.
Okay.
Yeah.
Good for you. We've got 3 as well. So I think we know the life you're living. And look, real quick, I just want to talk about grooming. I am a busy guy. I want to look good, but I do not want to spend a lot of time trying. And I couldn't be more happy to have found Based. They make amazing products. The one that I used is their Texture Essentials. It takes me about 30 seconds. My hair looks natural, no gunky stuff in there, and it holds all day long. And one of the best parts about Based products is they are naturally made. It is completely plant-based, no hormone disrupting chemicals, no harsh sulfates or ingredients. So if you're looking to simplify your routine with quality, reliable men's grooming products, go to basedbodyworks.com. That's BASED bodyworks.com. You can use code word Stronger Weekly for 20% off. And when you order now, any one of their sets, you can get a free toiletry bag. That's Stronger Weekly for 20% off. And let's get back to the conversation. Dr. Wallis, let's go to prenatal care. And for anyone listening, if you don't know, that means you are expecting a baby, right? Prenatal?
Yeah.
Okay.
Yep, that's it.
Like your wife. All right, let's just start with this. We'll start here. How would you say chiropractic care could benefit mothers who are expecting?
Similar idea, right? We start again back with the nervous system. And especially, what a, incredible time. And it's interesting too. Like when I was in school, I wasn't like, I'm going to go be a prenatal chiropractor. It'd be like almost weird, right? So But I want to take care of families. I love taking care of dads and dudes. And like at the end of the day, that's going to be a huge piece of the puzzle. And then obviously seeing it, with my wife, we've been blessed to have 3 home births, all natural. She's a rock star. We've had 3 babies at home. And so when a woman obviously is going through pregnancy, there's a lot of changes, obviously. I mean, her body is going through a ton hormonally. The process of a baby developing is a beautiful thing in general, but it's certainly from a physical perspective going to change the center of gravity. So a good prenatal chiropractor, the best techniques out there are called Webster technique for chiropractic for prenatal. It's focused on the pelvis. It's focused on the sacrum. It's focused on the nervous system again, making sure that, baby's in the right positioning. You need the uterus to not be oblong or anything like that so baby can get in the right spot. We need to make sure the pelvis is aligned and it's moving and the sacrum is moving appropriately so that when they go into labor, ideally, right, you're educating on the nervous system. And when they go into labor, the body is ready, right? And all that stuff happens. Women notice decreased labor pain, decreased labor time under consistent chiropractic care through their pregnancy. It's a really good piece of chiropractic, for families. So something fun to see. We have all kinds of pregnant moms in different phases. I've got 5 women due in April right now, which is pretty fun. So some was in the water 9-10 months ago. So
See, this one, if I just like before meeting you and you educating me on this one makes sense to me. Not the pediatric didn't. I just didn't think ear infection, chiropractor. This would make sense just because, I've seen my wife go through 3 deliveries as well. And just like the weight and just her communicating and articulating like how her body's so uncomfortable. So this one makes sense to me. And that said, when would you recommend if a woman is expecting, when would you recommend they first come out? Again, proactively keyword here, but would it be like first trimester, second trimester, all the way through? How often? Can you just unpack that a little bit?
everybody's case is different. Every situation is always different, of course. That's not to kind of caveat that, but in general, I think sooner is better. Earlier on in that first trimester, I think is wonderful if you can, because again, you're starting that process early. You're getting the nervous system adapting and functioning appropriately early, especially in those early phases when, I want to make sure all those nerves that are going to the baby and to that developmental process, that there's no interference happening within any of that. Again, God made the body incredibly to be able to do all that. And so we want to make sure we just optimize that, right? So earlier is great. A lot of gals, when it comes to pain and stuff like that, they might start later because, if they never knew, or they're like, man, my back hurts, I'm in second, third trimester, they'll come in at different times. Earlier is helpful because then again, you're making sure the round ligaments, for example, there's different things that we do to help optimize the positioning of the baby as well. And we're not practicing obstetrics and turning babies, but is it true that if the baby has the right position, the right room, all that kind of stuff, if that's going better, are they more likely to get in the right position? The answer is absolutely. We see moms come in that are, maybe they do have a breech baby, for example. And so again, we're not turning the baby, but there's some really good things that we can do to help open up, that whole system, basically help the baby turn itself, for example. You combine that with good prenatal massage and exercises and stuff like that. It can be a great window. So any point's good. Earlier is probably going to be better to really answer your question specifically.
Yeah, I bet you like the OG moms that have been around the block, they're on baby 2, 3, and 4. They're like, yeah, I'm going early because I don't want to get to the point where I have to be reactive, right? And need it like later on.
I hear that all the time. I hear that all the time, especially moms are on their second, third kid. They're like, man, I'm starting this earlier next time. You know what I mean? Like, yeah. Because they know. So it's a great spot to be.
Cool. And I guess this question applies to the pediatric piece too, but I forgot to ask it. Does a chiropractor, do they need a specialization in advanced training to be able to have that specialization, or can all chiropractors do prenatal and pediatric patients?
It's a good question. I mean, there's definitely some advanced specialties that are better for prenatal and for pediatrics specifically. What I'm a part of is the ICPA, so the International Chiropractic Pediatric Association. They do a wonderful job and provide my certification, whether it's through different pediatric courses or definitely the prenatal certifications. There's some great organizations right now through PX Docs is one that I think of all the time. They do a great job training chiropractors. So we do learn, pediatric and some prenatal care as a baseline in school. But I definitely think having a chiropractor with that extra credentialing through the ICPA, through PX Docs, through these different universities is a better way to go. And I think a good chiropractor worth their salt will be honest about like their specialization, right? And what they do. for me, I love to see families. I love to see athletes. I love to see dads. I don't want to miss dads. You know what I mean? I feel like we leave dads out all the time. I'm like, come on, dad. Don't just send your wife and kids in, dude. Let's go. You got to take care of yourself. That's kind of my gig. But yes, specialization is definitely a good spot to be.
Yeah, kind of a built-in takeaway there is if there's a mom or maybe a husband with a pregnant wife thinking about getting care prenatally, maybe if they're looking for chiropractors near them, maybe look for those letters, look for those certifications, or at least ask the question, right?
Exactly. ICPA is a good one to remember, and Webster technique. Does that for pregnancy? It's Webster. Is your chiropractor advanced certified Webster technique? That's the one that is best for prenatal.
Got it. Cool. Let's move to this one. Not that I wasn't excited about the other two, but I'm excited about this one, sports chiropractic, especially for kiddos. Because like I said, I've got 3 kids, 8, soon to be 6, and then 3. So the 8 and the 6-year-old are all in on sports. Gymnastics is where both of my daughters have landed. Soccer and gymnastics. They absolutely love gymnastics. Just last night, my kindergartner was trying to get this thing called a back bridge, I believe. But basically, picture leaning straight back over your head, touching your hands on the ground, and then flipping over. And she's like, Daddy, watch this. And I'm just watching the way this little girl's body is bending and contorting. I'm picturing myself doing it. No shot. I see them out there doing all these things, and I'm so excited for them, but I'm so cautious and afraid watching the things that they're doing. And I'm always asking myself, what can I be doing as a father proactively just to prevent injuries and fortify their little bodies? I've got a decked out gym downstairs. We've decked it out gymnastic stuff. I'm like, when is it right to start training with them? But through the lens of chiropractic care, how can that help not just kiddos, help any athlete, because the word sports is in here, and maybe just unpack that specific specialty if you could, and then we'll weave in and out.
Yeah, totally, man. Well, I think so. Unpack the specialty specifically. I've been fortunate the last couple of years. We're the preferred chiropractic provider for CSU athletics. So we see right now I've got football guys and primarily basketball guys at the moment. I've seen some track athletes, volleyball, golf, whatever. So that's been pretty fun. And I think what I educate them similarly. I'm like, look, what we want is for your body to perform at the highest level. In order to do that, you need your brain and your nervous system firing, dude, on all cylinders. And so at any point, I don't want any neurological interference happening with your muscles, think about reaction time, right? Think about proprioception. If you've heard that word, it's basically your body's awareness of itself in space. If I stand on one foot and I try to catch a ball or whatever, and I'm trying to adapt to a fly route, or I'm trying to flip around and catch a gymnastics bar, it's all about my body's awareness of itself in space, and that's where chiropractic plays a huge role. Is making sure to optimize that. I've got actually an immediate example of this. So on the side, I'm 38. My midlife crisis is I train jiu-jitsu as part of my athleticism, dude. So I'm like, I should be golfing. Why am I choking out anyway? So I trained jiu-jitsu, and the other day in a takedown, I tweaked my neck and my left arm went numb. And I know exactly what happened, C8T1 junction. Like I totally just tweaked it, sent my left arm numb. And for like the last week, I go to the gym and I can't hardly bench press. My left arm's doesn't want to work, and I know what to do. It's going to get better, but you transition that to an athlete. A football player has a stinger and it feels better, but they don't even really know that left arm is functioning at, 70% of normal. And now we're setting up for injuries, things like that. So there's a couple applications, but the most important one is the nervous system side. And some really, really cool research in chiropractic is showing that when athletes get adjusted, they actually improve their reaction times. So actually showing that nerve impulse from the brain to the muscle improving. And a really cool chiropractic video that we all shared is when was this? 2016 Olympics or something like that. Usain Bolt got adjusted right before he ran the whatever world medal, gold medal race. And all the chiropractors yes, because they get it. It's dude, I want to make sure I'm firing on all cylinders. I want no interference from my brain to those fast twitch muscles, right? And gets adjusted, goes out there, crushes it. And we're all like, it's cool because he got adjusted, obviously, right? So it's cool. Professional sports teams, they all have a chiropractor, right? Most of the colleges do, and there's a reason for that. And so I think some people fall into just the rehab side. It's okay, which is awesome, by the way. There's a whole group of chiropractors that do a lot of rehab, and they're focused on mobility and rehabbing injuries, stuff like that, from the chiropractic specific. And when I talk about it, mostly that's awesome. And like, let's make sure your nervous system is optimized so that everything else kind of comes into play. Does that make sense?
It makes complete sense. And when you think about reaction time, when you get in, I mean, D1 sports like CSU and professional sports, milliseconds matter. So I'm picturing like a baseball player trying to hit 100-mile-per-hour baseball. I mean, that matters. Or when you're moving at these explosive speeds on the football field, every single like millisecond matters. So if there's anything that an athlete can be doing to improve that reaction time, they should be doing it. And what better glowing recommendation for you personally and professionally, and also just the entire kind of industry of chiropractic medicine than professional sports teams having a dedicated chiropractor. I mean, that's all you need to know. If they're investing in it, it's doing something, right?
Totally. Totally. Well, and that's the whole idea too, is just making sure that like their athlete, like you said, is optimized. You know what I'm saying? And every movement, every reaction, everything comes back to the brain. It's awareness of itself. And now you're talking injury and injury prevention. Subconsciously, if your brain's like, okay, I've got something up with my hip, but I'm like, I feel okay enough to keep going. We're putting load on other things. I mean, there's a lot there, dude. A lot to unpack, but it all comes back to the neurological input to and from the brain.
How about, I'm going to come back to BJJ in a second, but how about your everyday dad, because you have a heart for dad staying healthy, who are like, pretty serious about their fitness? I mean, me personally, I strength train 4 times a week, upper, lower, rest, upper, lower. The first half of the week is strength training. I'm putting heavy loads on my spine with barbell back squats. I'm putting heavy loads above my chest, both overhead press and bench press. Do you think that people, and I'm going to assume especially as they age, but do you think that people who are pretty serious about their general fitness, maybe not like a D1 athlete, should also be interested in chiropractic care from a preventative standpoint?
Yeah. Well, dude, first of all, keep it up. Right. I love it. Get the weights on there. I mean, it's like, dude, lifting heavy is so good and so important, especially as dads, man. Like there's so many different things to carry and balls in the air, and we're trying to provide and we're trying to be good husbands. And it's like, we gotta lift weights and hormonally, all that kind of stuff, dude. It's so key. So thank you for saying that, and proud of you for doing it. Keep it up. I think there's the more guys need to be out there. So but yeah, I think, again, think about it from a perspective. Like if I asked you, I'm like, Jesse, would it be better for your body to adapt to the physical, chemical, emotional stress you're putting on it, to adapt to the weight that you're putting on your back? Do you want to adapt better or worse over time? Like, well, I'd probably rather, adapt.
The whole purpose of training is adaptations and driving.
Exactly. And adaptation starts in your nervous system, right? So I'm like, dude, yeah, then yes, you should get adjusted, right? It's going to help you adapt. It's going to help you get those gains faster. It's going to help those hormonal changes that you want to have, boost the testosterone, whatever it is, dude. It's like, it all comes back to your nervous system. And so yes, dads should definitely get adjusted. It's not selfish to take care of yourself, dad. Don't buy into that trap. You know what I mean? They're like working hard, all that kind of stuff. You will always have my honor and respect in that. But don't miss that you taking even 30 minutes, bro. If I've got 30 minutes in the gym, I'm still going to go hit it for 30 minutes because I know I'm going to show up as a better dad, dude. And if I feel better and my body's adapting better to stress, even that itself, and I'm sleeping better, all of a sudden, dude, how's that affecting my mood? How's that affecting how I'm showing up for my wife and kids? Am I less of a short fuse? Am I having better, relationships? Like that's where you can catch me getting really fired up about all this stuff, dude, because I'm like, you can change, you change how a dad shows up for their family if they're taking care of themselves. If your testosterone is in the tank and you're tired and you're stressed out and you're just angry about the world, like, dude, that's a different guy showing up than is over here optimized naturally, right? Does that make sense? So
it makes complete sense.
Another topic, 100%. Really important, dude.
I'm completely aligned with you on that. We'll go down a quick rabbit hole. I've seen some videos. You squat heavy, you lift heavy. What program are you running right now? What's your strength training looking like?
I mean, I like to play the actor on TV sometimes, but I don't feel like I squat that heavy. But you also compare yourself to everybody, right? I train at a local gym here, and one of my good buddies is their sports performance coach out there. I don't know if I'm going to throw names out or not, but anyways, he helped me a ton early on because I'm like, all right, man, I want my wife to think I look awesome by the pool. Okay. But I also want to still feel like I move like I was 25 and be an athlete. Is that possible as a 38-year-old dad, And I think it is. And yeah, it's different and there's realities and, we have to, and we laugh and have fun with it. But at the end of the day, like going from there. So I lift heavy. I include deadlifts and, bench and squat and all that stuff that's really good and important, but I keep up with the athletic stuff too. I try to run and do some sprints. I'm going to put sprints in quotes. I happened to video myself sprinting the other day, and I was like, dude, that was ugly. I don't know what that was, but that was not a sprint, dude. Whatever. That was like maybe a fast jog. Anyway, box jumps, right? Like stuff like that. Like try to feel like an athlete. I think that's a really good, and it's a good way to stay healthy too and not hurt yourself. And then on the cardio side, I do jujitsu primarily.
Yeah. So how long have you been doing jujitsu for?
I've been doing about 2 years, man. So I'm still a total rookie in the club, I think, but.
You doing gi or no gi?
Both.
Both. Okay.
Yeah,
so 2 years, blue belt?
I'm a blue belt. Yeah.
2 stripes? You do stripes out here in Colorado?
The gym I'm at now does, and did before too, but yeah, I've got a 1 stripe on my blue belt. Sometimes I think I need to throw back on the white belt, but I think that's normal in jiu-jitsu to feel inadequate all the time. It's the most humbling thing, dude. If you've never gone toe to toe on a mat with another man, you're talking about getting humbled. Holy smokes.
Yeah, man. So you're 38. I'm 41. You sounds like you started when you were 36. I started when I was 33, I would say. And sounds like similar to you. And we can probably, riff about this offline, but it just felt like, you can challenge yourself by yourself in the gym by putting more weight on the bar. You can always do another rep. You can always do more, but it just felt like for me, I wasn't truly pushing myself unless I was like head to head with another human being, like another man. So that made me want to go to do jujitsu. The conditioning was amazing. And I found early on that because I've been strength training my whole life, that like I had some advantages against white belts. Like, so if I go in there and you throw technique out the window and I just got to like, but then as soon as I got up there with the U's, so the blue belts now and the purple, like that, the strength advantage kind of just went out the window. I don't know if you can relate with that as well.
Totally. Oh, I mean, it still helps, but yeah, there's nothing like getting humbled by a 140-pound brown belt and it just like ties you up in a knot, So you must be at least a brown belt, huh?
Oh, I stopped. So I stopped. And you mentioned your shoulder. So
sure.
the first time I stopped, because I actually wound up hurting somebody else, and that's a different conversation. But when I came out here to Colorado, I started practicing again, and I actually got caught in an arm bar. I should have tapped. I didn't. I felt like I could kind of like hip out of it. And actually, the guy that had me in the arm bar and me both felt like everything just pop in my arm. And it was like a 2-year recovery. And now I'm itching to get back in. And I may actually wind up taking my son when he's old enough. But I for now have hung up the gi, but you might convince me to jump back in.
Yeah. Well, I think everybody should take that walk, the walk out onto a mat and just, men should. That's, again, I'm biased, but I think there's something it takes a lot of courage and it takes a lot of, just to go out there and try something new and get uncomfortable. But I think getting uncomfortable is very, very important. Again, probably another episode, another time, but it's big.
I agree. You cold plunge by any chance?
I did for a while when it was cool for a minute, but not so much anymore. I think that piece of it's good, but now it's more sauna for sure.
Yeah. Now you just mentioned, I just said, shout out to Ben Barker. He was my guest last week, and he said something similar to what you just said, but like it's important to do something hard every week. And he threw out like whether it's like an interval run, sprints, cold plunge or something. And I'm currently cold plunging. I'm doing it for about a year, but it goes kind of back to your conversation around the central nervous system that I've found tremendous benefits, especially if I go all the way down to the top of my neck. Let's just say I've had a really busy day, kind of ruminating about the day, and I got to put my dad hat on without putting all my work stuff kind of in its place. And I just feel kind of dysregulated. I found that when I jump into a cold plunge for 3 or 4 minutes, it just resets like my entire central nervous system. I've just found tremendous mental health benefits from cold plunging.
Man. Good for you. And that's exactly why. It's because that nervous system benefit of like adapting to something hard and knowing that you can do hard things, right? And holding it down there. There's all kinds of good benefits on that, man. But good for you. That's awesome.
Yeah, man. I'll tell you what, we'll trade. I'll go to wherever you practice BJJ. You could beat the hell out of me. You come over to my house, I'll throw you back in the cold plunge.
Deal.
We can both do something hard.
That's good.
All right, let's be honest. You're probably not a professional athlete with a personal chef and unlimited recovery time. If you're like me, you're hitting the gym at 5 a.m. before work or squeezing in training between meetings, just trying to stay consistent while life keeps throwing you curveballs. That's exactly who Purist Nutrition was made for. Purist keeps it simple. NSF certified supplements with minimal, clean ingredients that actually taste good. No artificial ingredients and no proprietary blends where you're guessing what you're taking. Just premium actives like CreaPure, the purest creatine on the planet, whey isolate protein that is US sourced and easy on the stomach, and hydration that keeps you going without all the extra sugar or sodium. Whether you're a parent juggling kids and training, or just someone who refuses to compromise on quality, Purist Nutrition fits your routine. Built for tomorrow, science-backed, tested and trusted by athletes, and most importantly, effective. Visit puristnutrition.com to see the full lineup of quality supplements. That's puristnutrition.com, because your nutrition should work as hard as you do.
All right, man, let's go to so like what I'll just kind of call this section more like practical takeaways. So if anyone's listening and maybe has not had the benefit from being treated by a chiropractor such as yourself, first question I say is, how do they find a good one?
That's a great question. I mean, I think, it's like any profession, anything, there's good things to ask and to know. I think, especially in 2026, Jesse, like chiropractic has so many wonderful advancements in the last 10 years or so. And I think for a lot of us, using technology in the beginning and doing a really good exam, I think chiropractic where you just walk in and kind of feel something and pop it, it can serve its place. And can that help people? Absolutely. So you won't hear me like bash it, but there's a place for testing, test and don't guess. And for a lot of great chiropractors, we're using advanced technology to actually measure, like, how's your nervous system doing? Like, if we say chiropractic is good for helping the nervous system adapt, should we be able to measure that? The answer is of course, right? So we use tools to see how the nervous system is actually doing when the patient shows up. I take x-rays, right? I'm not going to guess with the spine. I'm glad I do. Dude, I've seen things that, if you just walked in and we're just like going to get a crack somewhere and they didn't know what was going on with your neck, it could cause a huge problem, right? So we don't want to guess, right? And so when it's necessary, we take some x-rays, do some scans of the nervous system, see what's going on, take a proper history, right? Because at the end of the day, we want to know where the person's at, where they want to go. And it's up to us as professionals to go, hey, this is how I'm going to help you get there in the most effective and efficient way possible, right? So that's the questions is like, do we do a proper exam? Is there technology to know how my body's adapting? Are you a nervous system based style, or is it more just like musculoskeletal pain relief, which again has its place. There's nothing wrong with that. But I think, in 2026, the chiropractic focusing on the nervous system, especially for kids and stuff like that, we want to be specific and be very gentle and specific. Our style, man, is not, despite what I do in the gym and in jiu-jitsu, like it's not a heavy, hard twist, crack, pull. Like I'm not trying to, get the neck to go, you know what I mean? That has its place and that feels good temporarily for sure. Trust me, I get adjusted too. But what matters is specificity. So I think getting somebody who's really specific on getting the spot that needs it, not everything else around it, that takes a different level, it's a little bit harder because there's more education involved. People like to just feel that crack and feel the instant relief, which is great. The style that we do, you're going to get the relief, but it's also going to become your new normal, right? But just sometimes it takes a little bit of time and repetition. So does that answer your question, or did I kind of ramble again?
Yeah. Like kind of synthesizing it for myself, it's like when you're exploring maybe who's going to care for you, if it doesn't feel like they do their due diligence up front, if they just say, yeah, sure, here's an appointment, rip, and here's a bill, but that's probably not a good sign.
Yeah, well, there's a model of just like hit the high spots, hit the low back on the right, low back on the left, mid back, neck, high five, like, come back when it hurts again. Like that's, it's fine. And again, I'm not even going to say it's no good. I think there's going to be benefit. A lot of people for, 120 years have done well, with stuff like that, but I think that specificity, especially when we have the technology, like there's a lot of cool things that can be done, for people from a specific side.
Yeah. And specificity, I mean, I think we just covered a lot of them, right? Pediatric, you have prenatal, sports, there's all these different things, preventative that people can be doing. So love that. Last question before I'm going to kind of go towards like a rapid fire closer, which I love doing. As I'm sitting here listening to you and learning, I'm realizing that to the common person, which is myself, there's like kind of interplay or maybe even some redundancy between like physical therapy and chiropractic care, right? Especially if you're treating an injury. What would you say to that? Is there commonalities? Do you ever work in conjunction with the physical therapist? Do you kind of offer some of the same advice that a physical therapist, even a sports trainer would and could, if you think that would help them? How does that all kind of play out?
I think the best thing to do, like what I do is not physical therapy. right? And so I love it when I work with a great physical therapist. Like I've got some PTs that, are on, I've got their cards on basically speed dial. I'm like, look, you've got this thing going on with your hip. We need to like rehab that with like some stretching and some strengthening and all that kind of stuff. And that's a beautiful specialty. So it's very separate. At least it should be. This is my opinion. Some chiropractors are going to argue with me, and some PTs even don't like chiropractors because of this reason. Is we try and cross paths too much. I really think that when done appropriately, these two specialties are totally unique and not mutually exclusive. Like people benefit from both for very different reasons. A great PT is not doing specific nervous system based chiropractic adjustments to affect the spine and how it's communicating to and from their brain. That is not what they're trained in. And a great chiropractor is not doing rehab on a specific injury or tendon or whatever. I mean, some might. So I get that this part gets a little bit washy, but at the end of the day, I think that the specific work that a nervous system based chiropractic does is not PT. And that's great for people, because a great chiropractor, a great PT is going to go, hey, this is what I'm going to do for you. And I think you should go see that PT to help make sure we get that shoulder rehab the way you want, get it strong again. Because we're not taking an hour to go through, training exercises and stuff like that. Like that's such a necessary component. So I think the more we can actually work together, man, and like, I love getting on the phone with PTs, with MDs, right? It doesn't have to just be a PT. But let me talk to your MD about, what we're doing here. Let's talk to your PT about the rehab that you got going for your shoulder. And let's work together to make sure that your situation's optimized. Because at the end of the day, dude, we want the patient getting the results that they want in the shortest amount of time. Two very different professions, and that both are going to be so important for people to benefit from each other. Does that help answer that question?
That's completely well said, well answered. And I would imagine that's probably how it works with your relationship with CSU, right? Like, because those athletes have, trainers, and I'm assuming they have PT, and then they're working with you, and you all got to be working together for the sake of the athlete.
I think that's part of the reason that we got that relationship, because I'll be honest, the athletic department at first was kind of like, oh, this is our realm. You know what I mean? Then I was like, no, like I'm not doing what you're doing, right? I'm not doing this stuff. Like I'm not going to tape their ankle and try to rehab their ankle injury. Like, please, you do that. What I'm going to focus on is their nervous system and help optimize them, because what we all want is for our athletes to be healthy and fast and strong, right? Like let's work together on that. So that's how that worked.
Yeah, and it's probably helpful that you yourself are an athlete and you train and you do those things, so you understand.
I appreciate you saying that. I don't feel like an athlete. I'm a midlife crisis wannabe still athlete. You know what I mean? So
send me the video of you sprinting, and I'll be the judge if you're an athlete.
Dude, I'll text you. You'll be like, "Oh my gosh, what are you doing?"
I'm sprinting tomorrow. Hill sprints, by the way, and you're welcome to join if you want to come.
Good for you.
All right, man, let's do some rapid fire stuff. I love this. I picked out a couple for you. If you can just kind of give me, as best you can, a high level answer. I might drag you into more specifics depending on what you say.
Sorry, dude. I'm so long winded. I'll do my best.
No, you're not. No, you're not. That's all good. All right, let's start with this first one. This might take you a little bit to land on this one, but what is the single best piece of fitness advice that you've ever received?
I think in general, we have to prioritize sleep.
How much sleep are you getting right now on average?
As a dad of young kids, it's not going to be great. So I try to get a nice 8 hours, but with a 2-year-old in the bed all the time, or a 5-year-old that wakes me up, you know how that goes. But I like to shoot for the 8 hours is where I try to land. But
go for the okay. It's aspirational. I hear you.
That's right.
Okay. What is your favorite way to stay active outside of work? And caveat, because I just learned you're into jiu-jitsu, your answer cannot be jiu-jitsu.
Cannot be jiu-jitsu. Oh. Man, I just love getting outside with my family. I love being in the mountains. I love the mountains themselves. I'm a bow hunter or a bow hiker, if you want. I walk around with an archery kit and, try to get animal. Anyways, just love getting outside with my family and hiking. And that's my favorite thing to do when we can just get some time and go up in the hills right here in beautiful Colorado.
All right, man, you'll love this one. Go to Bible verse or book that really kind of grounds you.
What is it? 1 Corinthians 16, I think 13, where it says, be men of courage, be strong, do everything in love. And so it kind of talk like the whole idea of being just that call out to men, in Corinthians that I'm talking about. I just love how it's like, hey man, be men of courage, be strong, do everything in love. I think that's verse 14. It starts off with stand firm in your faith, be men of courage, be strong, do everything in love. And so I just think that like really specific call out's good. Romans 12, Romans 12:9. Don't pretend to love anybody. Love must be sincere. Hate what is evil. Cling to what is good. Those always stand out for me. But yeah, man, what a specific book you said too. I think underrated, for myself at least. I had never actually done a really good study on the book of Titus, and Titus is awesome for like family life and like household type stuff. But I'll also say this right now, a group of guys and I are going through the book of Nehemiah, and dude, Nehemiah writes a masterclass on leadership, and on slowing down and pausing to pray before like making decisions. Then he goes and he helps rebuild the wall, and he's like leading the people through this really tumultuous time. And dude, the way that guy paused and he prayed and he sought wisdom and discernment, and then he galvanized the people around him to go out after a common goal. It's like, dude, it's like a masterclass on leadership. Nehemiah is.
Love it. I hadn't even like kind of connected those dots, and I've read the book. I love that.
And then obviously Proverbs, dude. Proverbs. I mean, you Proverbs every day. Like, I mean, come on.
I'm a Ecclesiastes guy myself.
Nice. Okay, let's go.
Yeah. Living life backwards. All right. Best advice for dads trying to balance, I'll say life, but work, family, health, fitness, all the things.
I think there's a lot of value in trying to harmonize your life more than balance. I think balancing is very, very hard. But I think when we can harmonize it, what I mean by that is like balance means I'm going to try to give like equal weight to different things, equal time. But harmonizing is like, maybe I'm going to include my kids in my work. Maybe I'm going to include my kids in my fitness. Maybe the home gym, Jesse, right? Like maybe I'm working out at my house, and guess what? I'm also like, my kids are catching the value of fitness because they're seeing me do it at home. And maybe they're playing and maybe it's distracting. And dude, the amount of times I've had to listen to the Frozen soundtrack in my garage gym, like it's not ideal, for a big squat day, you know what I mean? But it's like, but they're also seeing it. They're seeing mom and dad, prioritize their fitness. So that's what I mean by harmonizing. It's like, maybe we can kind of bring it all together. So it's like, there's not so many different cuts, but it's like, we can kind of bring stuff in and dude, it's hard. I mean, being a young dad and a business owner, if you are an entrepreneur, it is not easy, dude. And
no, it's not.
We've got to prioritize our faith and our fitness and all that stuff so we can serve our families well. But I think trying to bring it together has definitely been fruitful for me.
I love that. Harmonize, keyword. Yeah. Awesome. Last question for you. What is one thing you wish more people knew about chiropractic medicine?
One thing I wish more people knew about chiropractic really is that it is all about the nervous system and the body's ability to adapt to stress. And it's less about your back pain and your neck hurting. Is chiropractic great for back pain, neck pain? Of course, yes. And you should do that. But again, that's just the tip of the iceberg. And so if we could educate people more on adaptation, on the nervous system, and really empowering people in health naturally outside of drugs and surgery, that's the message I wish more people knew.
Love it. Well said. Hopefully this episode maybe helped with that a little bit around the education. I guess this is truly the last question for you then. I know you have a website. If you're local to Colorado, obviously you have Elevate Chiropractic, which is a practice that they could literally come and see you and your staff. But where would you send anyone listening to either follow you on social, go to your website, and just kind of learn more about what you do and who you are?
Yeah, I appreciate that, man. My Instagram is at Dr. Dan Wallis. Our practice Instagram is at Elevate Chiro. We try to make people laugh and have a good time, and just enjoy. So a lot of good educational things there. People can follow me there. Those are probably the best spots. Facebook as well, but Instagram is where we spend kind of the majority of our social outreach. And our practice here locally is in Fort Collins, Elevate Chiropractic.
Awesome, man. Awesome. This was great. It was everything I hoped it would be. Once again, man, thank you so much for saying yes to coming on the show. It was a pleasure to have you on Stronger Weekly.
Jesse.
Thank you.
I appreciate the opportunity, man. You're a stud. I love seeing what you're doing, and thanks for inspiring, so thank you for having me on. It was an honor.
That was my pleasure. Dr. Dan Wallis, everybody. See you next time. All right, everybody. That's it for my conversation with Dr. Wallis. I hope you learned something. I know that I did. I mean, chiropractors are out there just doing some pretty amazing stuff. And together with Dr. Wallis, I hope we shed some light on some of those things. Just as a reminder, you can connect with Dr. Dan at Elevate_Chiro on Instagram, as well as Kingdom_Dad on Instagram. You can also visit the website, whether you're local to Colorado and you're looking for some help, or if you just want to learn more about the practice, it's elevatechiropractic.com. That's elevatechiropractic.com. Big shout out to Dr. Wallis for joining the show. Thank you, buddy. And thank you, everybody, for listening to that conversation. Before we head out and sign off for the day, I always like to remind or inform where people can find and follow the Stronger Weekly podcast. So you can find us at Instagram. We're on YouTube. If you're listening to this podcast, we absolutely love it. If you could follow our show, leave us a rating and review, maybe forward it to somebody that could benefit from the content that we put out there. We always really appreciate that. Our website is strongerweekly.com. That's strongerweekly.com. We are in the process of revamping that website. We're just going to have blogs every single week. Episodes are going to be on there, free resources for fitness and workouts and training. So keep checking in with us. We also have a newsletter that you can go to our website or find us on Instagram to subscribe to that. What we do is we take all the news for the week and the episode, and we send it right to your inbox so you can stay on top of all the health and fitness news that's out there. So one more time, thank you so much for joining the Stronger Weekly podcast. Stay strong out there, and we will see you next time.